It really is.
A major threat comes from individuals known as U2O, which translates to medical shills. These are highly organized scammers who physically roam the crowded, chaotic lobbies of major public hospitals.
Yeah, they target people who look lost or overwhelmed. They strike up conversations, playing the role of a sympathetic fellow patient or a helpful local. Once they gain your trust, they lure you away from the legitimate public hospital, steering you toward unlicensed underground clinics or selling you counterfeit, wildly expensive medications.
And the threat of fraud extends beyond just the lobby scammers. It reaches into actual, seemingly legitimate private facilities. The report details a deeply disturbing case involving the Ouya Men's Health Hospital.
That case is horrifying.
It is. This facility utilized aggressive search engine optimization to lure in unsuspecting patients seeking minor procedures. The doctors would begin the surgery, specifically circumcisions under local anesthesia. Mid-procedure, while the patient was literally cut open on the operating table, the surgical team would stop.
They just stop.
They would falsely claim they had discovered a severe, life-threatening complication, such as a cyst or an infection. And they would hold the patient hostage on the table until the patient verbally agreed to pay thousands of dollars in extortion fees for unnecessary, immediate corrective procedures.
Extortion happening mid-surgery is a horrifying reality of this black market. And these scams are not contained within China's borders. They have gone global.
Right.
The FBI has actually issued serious warnings about sophisticated telecom scams targeting Chinese speakers abroad. Criminal syndicates spoof the phone numbers of legitimate U.S. health insurance companies. They initiate video calls presenting fake medical bills and demanding immediate payment.
And if you refuse,
If the targeted victim refuses or questions the bill, the scammers transfer the call to an accomplice impersonating a Chinese police officer. This fake officer then threatens the victim with international extradition for medical fraud unless a massive bail amount is wired immediately.
unbelievable. And domestically, there's also massive fraud involving the National Healthcare Security Administration. Criminal rings forge prescriptions to steal high-value cancer drugs from the public system to resell on the black market. If a foreign patient trying to bypass the official visa and hospital channels